Dear Dr. Rodríguez, it's an honor for me to have this interview with you. Thank you for having this opportunity with you to have this interview. Please, Dr. Rodríguez, can't you introduce yourself a little bit?
Oh, yes. First of all, the honor is for me to be with you because Argentina is at the end of the world, you know, and to get in touch with you, all of you, that's an opportunity to get closer of you. And yes. I am Dr. Iris Rodríguez, is in English. In Spanish is Iris.
Iris?
And Iris. And I am a laryngologist. I work at the Italian hospital in Buenos Aires, and I teach at the University of Buenos Aires, and I'm part of our society, the Voice Society, Argentinian Voice Society.
Yeah.
And I'm with you in the International Association of Phonosurgery.
Yeah, so, it's really an honor to be with you at the board. Yeah.
Yeah. So this is my introduction, and okay, and I'm very happy to. I am very excited.
Yes.
To be with you.
So, Iris, we're facing COVID all over the world. I think COVID is also in Argentina, Buenos Aires. What are the current restrictions in your faculty, in your hospital? Yes, what are the restrictions there?
Look at this. If you, I could start.
Yes.
Talking about the restriction of the community.
Yeah, that's fine for us.
City, and currently in Argentina we are living under social distancing rules.
Okay.
Particularly in the city of Buenos Aires, it's mandatory to wear the face mask.
Yes.
You know, and in the public places and stores and restaurants are allowed to serve food.
Yes.
Right now, but in a ventilated places, you know, in terraces or rooftop or something like this. If they serve indoors, they have to, they need to count with several windows in order to have the place very ventilated. People are allowed to practice sport as well between 6 p.m. And 10 a.m.
Okay.
And public transportation has some restriction too. But essential workers can use freely the public transportation. And other people are required to have a permission to use the public transportation. But government encourage people to use bikes, private cars, and in order to avoid not use the public transportation, you know. This is in general, in the general situation of the city of Buenos Aires. If you want to know at the hospital,
yes, please.
The restriction is a little bit special, you know. Every patient is evaluated prior to being hospitalized. Test is carried out, nasopharyngeal swab test and whatever. And according to their status, the COVID status, they are given a room in the COVID area or not COVID area. In case they need surgery, they will be taken to the COVID or operating rooms or no COVID operating rooms. The patients seen in the emergency room, in the emergency area, are treated as a COVID positive, always, until they perform the test, until we have the result. And on the other hand, visits are not allowed.
Okay.
Except for certain cases that have to be approved for the treating physician or the treating team, you know.
Yeah.
All the meetings from the different committees are held online like this.
Okay.
And most departments have divided their staff in groups, which go to the hospital in different days in order not to be exposed all the time all together.
Yes.
You know.
Okay. Okay.
This is the general restriction.
Yeah.
So the first was the city restriction. The second was the hospital restriction. And
yeah.
Yes, I don't know if you want to ask me something more or.
Well, at the university for teaching, is this online or students can come to the campus?
No. At the university is online.
Only online.
Only online. For the time being, only online. You know, we are the lockdown very long, and we are the longest lockdown in the world. You know?
When is the lockdown started?
March.
Oh my God, same.
March 19, and we are continuing in
oh my God.
Yes. You know, this is a little bit awful, and that's why I think that some restrictions are exaggerated. You know, since people already know how to make care of themselves.
Yeah.
And moreover, many shop and commercial activity have been deeply affected by this restriction, this long restriction applied in the last 6 months, 7 months almost.
Oh my God.
So I consider that some restriction should be made more flexible.
Yeah.
In order to help those people, you know, because a lot of people need to work.
Yeah. Especially the people in the little shops.
Yeah, of course. And step by step, people are letting know to the government that they need to work. They force to be more flexible, you know?
Yeah.
And, you know, I don't know if this is the right place to say, but this is true that maybe there are some political issue in the middle of this decision, you know?
Yeah, I know what you mean. Yeah, there are political issues in the pandemic. Yeah.
Yes. And as regard to the what happened if people didn't follow the restriction, fines may be imposed if people organize meeting, for example, indoors with more participants than allowed. So in general. But at the hospital, this is different because there is an emergency committee of the infectious disease expert, which educate some representative from every department. They give advice on how to solve certain situations in case of infection among staff. And for example, and as far as I know, they haven't had to apply any penalty. Mainly because people follow the rules, you know, in the hospital. So it's not necessary penalty. And even at the hospital, I think most of the rules are appropriate. But I don't fully agree with the prohibition to receive visits, since many patients are emotionally affected by being in a hospital, you know. And their isolation makes things even worse.
Yeah.
And a family get the medical report by phone, which is not enough for the patient to get emotional support or to get yes.
They want to see and to hear their family, and to feel their family,
Yes. This is. I would change a little bit.
Yeah.
I review. If I could, I would review the possibility of allowing visit to all the patients, regardless they are COVID positive or negative.
Yes.
Because we have positive. COVID positive patient and not COVID positive patient as well.
Yeah.
So if the relatives are very well instructed, they could wear the necessary PPE.
Yeah.
And visit the relative for a limited time.
Yeah.
That would be very nice for me.
Yeah. Okay. And Iris, if I may ask, in our country, there was a huge problem in the elderly homes. How is it in Argentina and Buenos Aires? Are these people isolated also from the community?
I don't understand which.
The homes for the elderly people.
Yeah. This is a very, very big problem for us.
Yes.
I have a story. Do you ask me in the questionnaire if I have a personal story? And for example, talking about the old people, the old people. And the worst story in the pandemic for me was losing one of my dearest professor.
Yeah.
He was 94.
Oh my God.
He was in the retirement.
That's the word, retirement home.
Retirement home. And as soon as for example, he was very special for me because as soon as I graduated, he suggested me that I should do my residency in ENT and join his staff later on. And I did that.
Yeah.
And it was really hard when he passed away because we couldn't say goodbye to him and pay homage, and there was no funeral.
No.
And therefore we couldn't be with his family to comfort each other.
Yeah.
And it will be always for me a sad story.
Yeah.
So this is very. I was very touched with that.
It's the same in our country, Iris. Also in the homes, people die alone. They suffer alone. Okay. Yeah. Perhaps there is a possibility to have the Skype meeting, but if you're sick and old, you want to feel your family. Yeah.
We need that. To get closer,
That's
necessary.
Yeah, that's necessary. That's a sad story. Yeah. And it's still going on, the lockdown for the people in the homes?
Yes. I don't know. The government said that we are news about that next at the end of October.
Yeah, maybe but it's still a long time.
Yes, they the government of city of Buenos Aires, where you stayed last year.
Yes.
They I think they are managing very well the situation, but the general government is a different political idea. So they are not so they don't have agreement, very good agreement,
Yeah.
So that's why we have some some differences. But I hope they will think about the feeling of the people, because such long lockdown is very dangerous for psychological
the well-being of the people. And what about these families with a low income? How do they survive?
Yes. This is a story, because in Argentina, the pandemic for me has given me the chance to learn many things. Many new things. How to use technology, for example, and which has allowed me to keep in touch with you, for example, with patient, family, friends. On the other hand, as our income depends on patient payment, it has been seriously affected.
Is it? Oh my God.
Yes, due to the lack of the usual number of patients. Consultation have dramatically decreased. Because of the fear to be exposed to the virus.
Yes.
In addition, I regret not being able to have a normal social and cultural life, especially not being able to travel, not to professional meetings, or go to the opera house,
To visit Teatro Colón, yes.
So this is positive and negative things
but Iris, have I understood it well that your salary is decreased during the pandemic?
Yes, at the hospital they decreased 12%.
Oh my God,
in order to to cooperate with the institution, because they spend a lot of money to provide us the PPE, a lot of...
Well, that's a huge difference, because in our hospital also the consultations decreased, but our salary stays the same.
Good. That's good.
But that's sorry for that in your country there's this imbalance, because
I think so, this imbalance. But Latin American country has a lot of problem. Has a lot of problem. We belong to the developing country,
that's
so
true.
we need I don't know, but we need new rules. We need other type of government, even if we know that the global crisis is in this moment a problem.
It's a problem.
And I don't know where are we going?
And Iris, how do students react? What is the reaction of students? Are they comfortable with the online courses?
Almost all of them are comfortable. Because they know very well technology,
Yes.
And they like that. Some of them not, but me, I miss them. I miss them. I need the eye contact.
Yes, I have the same feeling. The eye contact, to see the impact of your course, to see the impact of a question, to discuss a little bit. I know what you mean. I miss them too. Yes, but in our university, the first bachelor year and the second bachelor year are having courses on campus. and we divide the groups. So we have a carousel of several groups. Each week there's another group, and the rest of the group is taking online courses, is following the course online. Yes, yes. And from the third bachelor and the master, we have only online courses, except for the practical skills, the skills lab, that's on campus. So I was just wondering, how do ENT students learn practical skills?
Well, this is an issue. This is an issue. We are now started to have some small group.
Yeah.
But we are going to have, so not yet, you know. So we are planning to design how to give this type of activities.
Yeah.
But we still think about that.
Yeah.
No, for the time being, all the thing is online.
Yeah.
And we try to perform some workshop online with video, demonstration with video.
Yeah.
But it's not the same, you know.
No. It's not
the same.
No. Okay. Thank you for this interview. And Iris, that's the last question. Do you think the COVID-19 pandemic can change the world?
Oh, yes. You know, one thing I was thinking about that, for example, you asked me in the question, what do you wish you had known before COVID?
Yeah.
It made me thinking. And I wish I had been more aware of the weakness of the health systems in a globalized world, because we are not well prepared.
No.
And because where the contagious diseases could be spread in the blink of eye, you know, because of the globalization.
Yeah.
So that's I think we need to review it.
Yeah.
And what was your question?
My last question was, do you think this COVID-19 pandemic can change the world?
Yes, definitely, I think.
Yeah.
Because, for example, I think the future generation should be prepared with all technology possible.
Yeah.
To create virtual communities and virtual tools in order to reach out to others.
Yeah.
And living in solidarity.
Yes.
Is the only way to overcome the loneliness, the isolation, and anguish that a pandemic brings about.
Yeah.
Caring for others, caring for the environment, and concern for the well-being of all, you know?
Yes. Yeah.
So I think this, I hope we learn these things from the pandemic.
Yeah.
Because we need to be more concentrate, not only on ourselves, but we need to concentrate on the others.
Yes.
Around us.
To live as a real community and to take care of each other. Yeah, that's what you mean. Yeah. I totally agree.
And to take care of the planet, you know?
Yes, yeah. We have the same vision in Belgium. We have to take care of the planet. Our footprint was too big.
Yes.
Yeah.
And I think this is the first step in learning the pandemic brought about. But we are learning and learning, I think. According to, because we are living more and more things after the pandemic. I think new things.
Yeah, that's totally true.
Or if you allow me to say, side effect of the pandemic, you know?
Yeah. Positive and negative.
And negative, both.
Yes.
Yeah.
Both. Yeah.
Yeah.
Iris, thank you so much for this interview. I'd like to share with you the feeling that I had a wonderful time last year, a wonderful conference in Buenos Aires. I met wonderful people. There was a nice social program. I remember the opera and the Teatro Colón. It was a nice experience. I wish to thank you for that. I hope we can see each other in Philadelphia again in June. It will be
June.
Yes, the 5th anniversary.
The 5th anniversary. Yes.
Yeah.
I hope to be there.
Yes, we all hope to be there and to have this wonderful conference together with Professor Satalov again. It's always nice to be there and to discuss voice quality, voice technology, voice surgery. So I hope we can see each other next year.
I hope so. And let me tell you something. My husband Pino sent to you his regards.
Oh,
he always remember you.
Oh, thank you. Please give him my great greetings, and I wish to see him again also in Philadelphia if it is possible. He was there, not in 2019, but I think in 2018 he was in Philadelphia.
Yes, he was in 18. Yes.
Okay.
Yes. So we were there. Yes. And Kristiane, you like to? I sent to you this questionnaire. Or not? If it's not necessary.
If you want to share it with me, I'm very interested to read it. Yes, thank you very much,
because I put some picture as well.
Oh, that will be nice.
Because one thing that I didn't tell you is that pandemia. That's I almost forgot. The pandemia. The positive thing of the pandemia was that my husband and I have been able to live longer in our countryside, in our country home.
Yeah.
At the moment, we are living here at the country home. So we go twice a week to the hospital to work, and the rest of the time we do telemedicine. Okay. And this part is okay because we live in the middle of the nowhere, in the middle of the countryside. That's a good thing.
Yeah, that's good. Yeah. And I think living in the countryside is totally different in COVID times in comparison with living in the heart of Buenos Aires.
Of course, it's completely different. Yes. So, and I work a lot here. And as well, but it's free. It's open air.
Yes. Yeah. You can go outside.
Yes. And with my cat, my pet.
That's good. And, I love it. Yeah. Okay.
So
Iris,
that's the good thing.
That's the good thing. Yeah. Okay, I'm going to stop recording now, but keep, now we stopped the opname. Okay.